So one of the things that I find very helpful when treating my patients is using an approach that's called functional medicine. So using functional medicine is, looking at the whole person. What's going on in your life as far as stress. So then, we'll talk about stress management techniques. What's going on with your diet? Are you eating a food that's maybe causing inflammation? So there's lots of things that we can do with certain herbs and supplements to help treat the whole patient, using these methods along with the acupuncture. So throughout my over 20 years of study, I really keep up to date with what are the best brands, which brands stand up to the research, what brands are pure. You always want to make sure, is this a brand that's making a false claim? Okay, because the better, herbs that you see aren't going to tell you I can cure this or cure that. So, there's lots of things you can try at home, but then, some things, especially if you have several issues, you should consult a professional who knows a little bit about the product and how it might mix with your medicines or other healthcare issues. So you can see my blog, Health by Kate, and just keep up with some of the products that I'm using to find out. So one thing that I look at to rate and see which supplements are the best supplements, you actually have to join. It's called consumerlab.com. So it is an independent lab that will test supplements. So I get their emails to see, if something's had a recall, if some supplement made a false claim. So that's one good source. When you've been in the business for a long time, such as I have, the brands that also can be trusted, the brands that do good research. So one of the brands that I trust is Gaia, GAIA.com. The other one would be Metagenics. Some of the things I also tell my clients to do is to follow Dr. Mark Hyman, Hyman, on Facebook. So he's a good source for functional medicine information. And Dr. Amen, AMEN, also to follow him on Facebook. So he has a lot of up-to-date information on brain health.